Hi friends, welcome back to another episode of our Friday live transmission. Welcome back after Eid holidays. We did have many cases to revise, so let's go to our first case, which is surely a case of TGE. There is two vessels at the level of three vessels with a VCD, so mostly it's a case of DTGA. Very much share all the comments here. They were all right comments casing the diagnosis of DTGA. So let's go to the other case, which I consider a case report of congenital megalourethra. You will find that the phallus is somehow deformed large, and it's surely a case of congenital megalourethra in a case of IUGR. Congenital megalourethra. In a case of IUGR, mostly there is a chromosomal abnormalities associated with it. So this case of congenital megalourethra. Let's go back to our other cases. This one was a case of pectus excavatum. Yes, we are seeing here another case here of pectus excavatum. You can see the distinctive appearance of the chest. It's very the case of pectus excavatum, and you can see the appearance of the fetal chest. So apparent, the appearance of the fetal chest. So also associated with polyhydramnios, and surely there is a single umbilical artery. So let's go to the other case here. It's a very interesting case. The mother is 40 years old smoker with apparently radial ray anomaly in the fetal hands, also associated with an AVSD apparent. So we'll jump to the conclusion of a case of Holt-Oram syndrome. And yes, this was a case of Holt-Oram syndrome with radial ray anomaly associated also with AVSD that is so apparent. Poor baby of a mother, 40 years old smoker. It's a case of Holt-Oram syndrome. The next case was a case of partial vesicular mole. Apparent that the fetus is associated with partial vesicular mole. You can see also placental mesenchymal dysplasia. So you can never say the definite diagnosis, but as there is cecal lutein cyst bilateral, so the bilateral cecal luteins with the partial vesicular mole will give you the appearance. This is a case of partial vesicular mole, and I don't think it's a case of placental mesenchymal dysplasia. We did have a case here showcasing a twin with the three vessel view, and one of them showing a smaller aorta in comparison to the pulmonary and the superior vena cava. So mostly this is a case of interrupted aortic arch in one of both fetuses, and the other is totally normal. You can see here, yes, in the other fetus, it's coming here, the image. Smaller aorta in comparison to the pulmonary. Hereby you can see a large encephalocystocele, in this case large encephalocystocele, and not a case of cystic hygroma. Many comments were talking about cystic hygroma. Let's come to the case of the week, or like we say, the ultrapost or weekly ultrapost, or a case of true not in the umbilical cord, in a case of polyhydramnios with an excessive cord length. So this is a case of true fetal knot like we are seeing here, and this case of true fetal knot should be examined thoroughly by ultrasound to see something like this. And hereby we have reached our final case for this week. Persistent left superior vena cava, a fourth vessel at the level of three vessel view, and enlarged pulmonary, a very small aorta a smaller yes, left ventricle and tricuspid regurg that is apparent. So we do have here what we're calling the persistent left superior vena cava with unbalanced VSD versus hypoplastic left heart syndrome. Maybe there is a coarctation of the aorta as an origin of this case. I hope you did enjoy all the cases for this week. This were our Friday live transmission. I hope you do like this version of the live, and see you next week. My friends did put my attention that there was a defect in the last week cases. We did not discuss a case like this one, which was a case of yes, we did not discuss the case of duodenal atresia, I guess, with this amazing render. Yes, it's a case of duodenal atresia, and this case was an encephalocele. The encephalocele here was apparent in the render and is getting with it part of the brain and causing the triventricular hydrocephalus. This case also, I guess we did not comment upon it, which was a case of cephalocephaly with holoprosencephaly, single nostril with an apparent holoprosencephaly in this case. Single nostril with holoprosencephaly. I guess it was very apparent, and we did have here also a case of omphalocele. Yes, we did have here a case of omphalocele, and the omphalocele was containing the small bowel and the liver and the stomach. So see you next week, inshallah. I guess we did comment on all the cases from the previous week and this week, and see you next Saturday with a new case, inshallah.